Welcome back. September is Sepsis Awareness Month.
Yeah, sepsis is a serious medical condition, but many don't even know what it is. Joining us now, Dr. Abi Polzin with the Sanford Emergency Department. Doctor, thanks for coming in this morning.
Yeah.
First of all, a lot of people, when they hear sepsis, like, what is it?
Yeah.
Just explain what it is.
So sepsis isn't even its own thing. It's actually your body's inflammatory response to another infection.
Yeah.
So typically that's an infection of like the urinary tract, the skin, or the lungs. And then your body's immune system, in trying to fight that off, creates this inflammatory cascade that leads to dehydration and even problems with other organs. The actual definition of sepsis requires some laboratory values and some vital signs like heart rate, blood pressure, and so forth to make the diagnosis. But things that people could watch for is an infection that's not getting better or going away with treatment, or something that you haven't had it treated and you're feeling really, really sick, lightheaded, dizzy, feeling like your heart rate's going really fast, having severe pain. Those are a couple of the signs.
And how common is this? We kind of discussed this a little bit.
Yeah, so I don't have our actual numbers, but the CDC says that there's over 1.4 million cases of sepsis per year. And in hospitalized patients, it can account to up to a quarter of the deaths.
So could you have like just a common cold or something, fighting off the flu, and something like this could come out of the blue and happen to you?
Sepsis is more common with bacterial infections. So if you've had a cold that's been going on, it may have started as a viral infection, but it can progress into a bacterial infection. So things that are not getting better, especially with treatment. Say you got treated for your skin infection and it keeps on spreading, or you're having more pain with it, that could be a sign that it's not getting any better with the antibiotics that you're on and may progress to sepsis.
So what are some recommendations then that you have for people to kind of avoid this or stay on top of it?
Yeah, with everything, it's really early detection, and otherwise, also watching for the patients who are at more risk. So the very, very young, the very old, and then people that have other medical problems like diabetes or heart disease, they're at higher risk. Getting an early appointment with your doctor or being seen in acute care to get an infection checked out in the early stages is the best way to prevent it.
So that's kind of the main thing.
Yeah.
If you can get early treatment, the outcome can be
changed.
positive,
Yeah.
absolutely.
Yeah.
So.
I mean, in the emergency department, we look for patients coming in, again, with those high heart rates, low blood pressures, and then certain lab findings. And we actually time our time of arrival to the time we give them antibiotics, because it's shown to improve mortality and outcomes.
Yeah, so if you feel like you might have this or kind of have concerns, what should you do then right away?
Again, making an early appointment with your either primary care doctor or being seen in acute care. Of course, the emergency department's always open, but trying to get these infections taken care of early is the best way to prevent it.
All right. Well, Dr. Polzin, I appreciate you getting up early with us this morning to talk about sepsis, something you don't want to get, but it's good to learn a little bit about it.
Yeah.
And what you should look for. So.
Yeah.
All right. Well, stay with us. Fastcast coming up next.